Well, they've restricted travel to West Africa, and President Obama is actually thinking about increased screenings at airports for Ebola. Now we're hearing that 3 more are feared to be infected with Ebola in Europe, and another person is sent to Omaha suffering from Ebola. Tom Becca, ladies and gentlemen, is a talk show host for 1290 The Mighty 1290 Coil in Omaha. Good morning, Tom Becca.
Rob, good to talk to you again.
How many patients now are in Omaha or have been in Omaha infected with Ebola?
Shaka Mukro, who is the NBC cameraman, this is he's the second one to be here in Omaha. He's the second one. He arrived early yesterday morning, about 26 hours ago or so. He arrived in Omaha. He was healthy enough to walk off the plane by himself. He saw his parents across the tarmac. He waved to them, got in the ambulance, was transported to the biocontainment unit, and has been there ever since.
All right, so this is 2 or 3 now?
This is the second one. This is the second one. The first one was Dr. Sakra, who was here, who was treated and released about a week or so ago. He, with flying colors, very happy about that, and we wish the same results here with Shaka Mukro.
Yeah. Okay. So now they've sent some to Atlanta. They've sent some to Washington D.C. and some to Omaha. What's the reason for sending them to the different places?
Well, a couple of different reasons. Number one is that every doctor is, by having all these different doctors do it, they're all learning. The Omaha doctors have learned from Emory. Emory has learned from Omaha. They are learning how to treat it, best ways to handle it. They are able to spread it out a little bit, because let's face it, there are 40 people in Omaha right now treating this one patient. So to be given the care that they need to come out of it, it is very labor intensive. So it spreads out some of the workforce a little bit. It also is just a thing to, they've been training for this for a long time. Ever since 9/11, they've been training for something like this. And so therefore, it's just making best use of the facilities.
I understand Emory, which is where the CDC is, but why Omaha? What is it about Omaha?
Well, you know Omaha, McGraw. Omaha is probably the best kept secret in the country. The Nebraska Med Center is a phenomenal facility here. It has some of the best transplants. One of the largest transplant facilities in America. It also has the largest biocontainment unit here in the United States. It can seat 10 people. You ask why spread them all out. A lot of the biocontainment units of these other hospitals are, 1 or 2 patient biocontainment units. This has room for 10 people. So it's the largest biocontainment unit in the country. They've been spending a lot of time on research as far as viral research and learning about contaminants like this. So, yeah, Omaha is very well suited to handle something like this. Also, we've got a strong military presence here with the Offutt Air Force Base with the SAT unit is here. So it's very much the place for a patient like this to be.
So when you first hear that an Ebola patient is coming to your hometown, I'm sure a couple of eyebrows were raised, but it isn't like these people are going out and getting a burger for lunch. They're in quarantine. What has the reaction been to the people of Omaha now that they've had a couple of Ebola patients there?
Well, the first one, there was a lot more concern than this time around. The first time, there was concern, there was worry, there was panic in some people, but that's all subsided. The Med Center has been very good at getting information out, answering questions. They've been very, very good about that. The view basically is this, is that we know this guy is okay. We're not worried about this guy. This guy, arrived in a hospital in a biocontainment suit. It's the guy like in Dallas that people are concerned about. What happens about, the guy in Dallas who just shows up and has symptoms and goes to the hospital, and then what happens? We're lucky in Omaha in that we have these biocontainment units. But what happens if somebody, walks into a hospital in New York, in Chicago, walks into a hospital maybe in a place like Wichita, where they walk in and they're maybe not as prepared for something like this. That, I think, is the concern with a lot of the government officials and concern with a lot of people. Not so much concern when a patient like this comes to Omaha, because every precaution is taking place. The medical staff, when they work on these patients in the biocontainment unit, they're wearing 3 pairs of gloves. Let me give you a little insight as to what this unit is. It is basically a building inside a building. There's always at least 2 medical experts in the room at the same time. They work on the buddy system. Nobody's in there alone. They're wearing 3 pairs of gloves so that when they take them off, their skin never has a chance of contacting the Ebola virus. When they're in there, they're completely covered from head to toe. They get into another room. They walk into another room where they take off all their clothes, where they become decontaminated. Their clothes become decontaminated and put into a special room where they are then sterilized. Any biohazard waste is taken care of immediately and disposed of properly. So this is not, people are not concerned about this patient.
Yeah.
If there's any concern, it would be about the unknown factors of people that on a plane and just come over from Europe or something like that.
You know what's interesting about this Ebola virus and how the news media works is that this is the second patient in Omaha. You have 1 in Dallas. You have 1 or 2 in Atlanta. You have, now 2 or 3 in Europe. So, I mean, we're talking a number of people outside of West Africa, and yet the attention to Ebola is overwhelming with this enterovirus, where they've got 500 plus cases, 43 different states. No one really knows when, where, why, or how. That seems to be a bigger threat, and yet that doesn't seem to be getting as much attention as Ebola.
Well, yeah, except you mentioned 500 cases as opposed to the thousands and thousands and thousands of cases over in Africa.
Well, I'm talking about 500 here in America, though.
Well, here 500 in America, but I'm saying in that there's been just a few deaths, thankfully, with this other virus. I believe that the experts feel that the Ebola is a much bigger threat than this the virus that has hit these children.
Right. Yeah.
I think it's about what the virus can do. From what I understand, in talking with Dr. Sacra, the first patient that was here, when I spoke with him after he was healed, it is a very violent illness. Blood, nausea, diarrhea, and it is a very violently ill illness. Last night, Mr. Mukbo was feeling well enough to order some dinner, but by the time the dinner came, he couldn't eat it. He was right. Too sick, too tired to eat. So it's maybe it's because it's a more violent illness. You look at it this way: 36,000 people die of the flu in America every year.
Right. That's good.
So, yeah. By comparison, maybe the media coverage of this is overdoing it. At the same time, this is a concern, and it is a concern that the doctors have, and it definitely is news.
Yeah. What is the diagnosis? It seems like, because we hear Ebola and automatically we think death sentence, but these people are getting better. What is it about some people who are living and there's 1 or 2 people who aren't doing so well? What's the difference?
Well, if they get to them, as I understand it, I'm far from being a doctor, but as I understand it, if they can get to them early enough, if they can hydrate them, keep them hydrated, keep them their blood pressure stable, if they can keep their vital signs stable and hydrate them and give them plenty of rest, that if they're young and healthy enough, otherwise they got a good chance of getting through it. It's about a 50-50 case right now of survival on this, about 50-50. As you hear the reports of the gentleman in Dallas, not doing as well,
right.
It appears at least, by all reports, he's not doing as well as the other patients have done. And maybe a lot of that probably is because they didn't get to him in time. A lot of it is because of the medical care available. It's about a 50-50 chance, as I understand it, of these patients surviving Ebola.
Tom, I'm short on time. If you're diagnosed with Ebola and you survive, are you then immune from it going forward?
Yeah, you're immune, and actually that's what they're using in some of these experimental treatments. They're using the blood from patients that have survived Ebola because of antibodies that build up in there, and then therefore they're using it as part of treatment for other patients. As a matter of fact, Dr. Sacra had received blood transfusions from a previous Ebola patient as part of his treatment when he was here in Omaha the first time.
Interesting stuff. Tom, be safe. Stay away from the Ebola patients.
I'll do my best, but I'll keep on top of the story.
Ladies and gentlemen, Tom Becker from the Mighty 1290 Coil in Omaha with the latest on all this Ebola stuff. Tom, be safe. Talk to you soon. 7:50 here on the Big